Okay, good morning everyone, and welcome to the VHHA sponsored webinar on creating a culture that fosters employee engagement and patient experience. I would just like to review some general housekeeping items before we get started, just in case you are new to this platform. Slides were sent out this morning to those that were registered. If you registered late, you can also access the handouts in the Handouts section of the GoToWebinar platform. This webinar is being recorded so it can be shared with others who are unable to attend live. We do ask that you please dial in using the telephone option if you are able. You'll be prompted to enter an audio PIN, and this will allow us to have a conversation at the end of the webinar. At this time, all participants are muted and all panelists are unmuted. If you do have a question, you may ask it in two different ways. One, you may raise your hand by using the palm with the arrow on it in the GoToWebinar platform. Hopefully you can locate that now, and I ask that you practice using it so that we can be sure you can ask your questions later. It is located on the left-hand side of the Grab tab. Please do this if you are dialed in using the telephone only. The second way you may ask a question is if you dialed in using either the computer's audio or the telephone option. You may ask a question by accessing the Questions platform, which is also located on the tab menu. I'll also add that this is a much easier method of asking questions than it is to raise your hand, so keep that in mind as we go forward. We have a good bit of material to share with everyone that I've included in the slide deck. I do want to respect Mary Catlin and the Virginia Hospital Center's time and effort they put into preparing for today, so I will not be going through each of these items, but I've included them for your reference. If you have questions on any of these slides, please email me, and I'll be happy to answer any questions you may have. I wanted to ensure you knew who you've been working with and hearing from over the past 6 months. On the left is myself. I know I've spoken with most of you by now, or either by phone or email, and on our right is our staff consultant, Carrie Brady, who's been providing extremely helpful guidance as we begin to develop our strategic plan for this year and the deliverables we will be providing. So you guys will all be hearing from Carrie in our July webinar. Listed are the Center for Healthcare Excellence's board-approved goals through 2020. You'll see that number 3 is our patient experience goal to improve the state overall rating from 70% to 75% by 2020. So this is the reasoning behind the collection of the data set with the overall rating. We're adhering to the board's wishes and trending that performance over time. So thank you all that have been willing to submit that data to me. And if you haven't done so, there's still time. Please just reach out to me. I'm just going to briefly go through our strategic plan for the 2017 year. Here are a list of the learning sessions that we have planned through August. So we do have webinars planned for October, November, and December as well, and I'll be sending out those communications at a later time. So these topics were highly requested from all of our members in my conversations with you guys, and I really think they're going to be beneficial in supplementing your work efforts at your facilities. Please mark your calendars, take advantage of this opportunity to learn and interact with other members and leaders across the state. And again, just a reminder to save the date. Our next webinar next month will be geared towards engaging patient advisors and advisory councils with a special presentation from the American Institutes of Research. I'll be sending out that registration link in the next few days. And lastly, I just wanted to review our big deliverable for this year, which is going to be an HCAHPS improvement guide that's going to have 3 major sections. So one section is going to be building a solid foundation, focusing on foundational approaches to improve patient experience. The second will be more data focused and using data effectively within your facilities. And the third section will be topic specific strategies that will be more domain specific with respect to the HCAHPS survey. So essentially, we'll be creating a toolkit of Virginia hospitals, of case studies from Virginia hospitals highlighting key strategies and best practices they've implemented that have positive impacts on their performance. So this is a fantastic way to get recognition and be featured in a publication that will be distributed statewide. So, if your facility has seen an improvement as a result of a best practice or a key strategy, and you would like to be included, please reach out to me. Or if you've seen improvement as a result of using a resource like Binary Fountain or a new bedside shift reporting tool, please reach out to me and consider the opportunity to share. Again, this is all about featuring you guys, recognizing you guys on all the great work you're doing throughout the state and within your respective facilities. With respect to time, I'm not going to go through all these data slides. I've just included them for your reference. We're going to go through these in more detail in our July webinar. If you've not submitted data to me, there's still time. Please get in contact with me. Just as a side note, there's going to be an online interactive data dashboard that will be released with the improvement guide in July. I think it's going to save your hospitals a lot of time, allow you to see your trends in each of the domains over time, so I'll keep you posted on the status of that dashboard as we move forward. It is my pleasure to introduce our guest speaker, Mary Tyson Catlin. Mary is the Director of Patient Experience at the Virginia Hospital Center. Prior to this role, Mary led clinical strategy work for the Dana-Farber Cancer Institute in Boston and worked clinically as a certified child life specialist in Rochester, New York. Her undergraduate degree is from Northwestern University, and she holds a master's in business administration and a master's in human development from the University of Rochester. Without further ado, Mary Catlin. Mary?
Good morning, everyone. Thank you very much, Mike. You have put so much time and effort into getting this whole thing set up, and I really appreciate all of that. So everyone in Virginia, it's nice to at least speak with you over the phone. I look forward to the opportunity to network with all of you. And I'm planning to speak today about creating a culture that fosters employee engagement and patient experience. So we'll dive right in, and I just want to start out by saying that I really welcome this being an interactive session. So I know Mike described earlier how you can ask a question, but please feel free as I go through to go ahead and do that. I'll sort of pause at the end of each section just to see if there are any questions so that we can make sure that we're really addressing the things that are most important to all of you. So to kick us off, I want to talk about the way we sort of look at and approach patient experience in general here at Virginia Hospital Center, and we really see it as a three-legged stool. And the three different components of the stool we see as being safety and quality, patient experience, and employee engagement. And the idea here is that we really can't have any one of these things without the other two. Safety and quality is a huge focus of our work, and whenever I talk about patient experience, I always really like to start by pointing out that there's no such thing as patient experience without a safe, high-quality care platform, and being able to make sure that staff are really aware that we don't see these as two separate things, but that them being able to focus on a culture of safety and providing high-quality care for the patient is what sets the stage for the rest of patient experience. And employee engagement is such a huge piece that underlies both of those things, making sure that our employees are empowered and have all of the information they need to be able to provide a safe, high-quality experience. So what I'm going to talk about today is actually mostly the employee engagement and patient experience pieces. We are doing a lot of work here at Virginia Hospital Center very actively on culture of safety and the quality of care that we provide, but I will focus on sort of the other two pieces, but really wanted to start out by recognizing that other really crucial piece. And so just to take a little bit of a look here, without having both pieces of the stool, the whole thing kind of falls apart. So I'm going to talk about both of those legs and how we really support them and make sure that they're nice and strong so that we can have that full comprehensive experience for our patients. We really believe here at Virginia Hospital Center that it begins with culture, and in my time here, I've been really impressed by our culture, and I think a lot of things that we're able to do stem from the culture that has been built here over really decades. So this is just a photo of our strong NICU team, but it's an interdisciplinary team. This place is sort of characterized by warmth, by support for each other, dedication to our patients, and so that's what we try to continue and really have thrive within our environment here. So sort of dive in a little bit into the employee engagement piece. I'm going to talk about these various pieces that we take really seriously here and how they play into our culture. So I'll start out by talking about how we hire the right people, how we orient these new employees to our culture, what education, career development, and team building opportunities we share with our staff, the employee surveys that we do annually, and then I'm going to go on to talk a little bit about how we share our patient experience data and what the accountability structure looks like in that regard. So I'm going to start out with how we hire the right people. I really think this is the absolute beginning of how we're able to create the culture that we want here. And what we're looking for in this culture is a culture where really every single person is going to put the patient first every time and be able to support their colleagues to do the same thing. We're looking for the kind of people who are going to do the right thing for patients even when nobody is looking, and are able to support their colleagues in doing the same thing. So we have a really robust employee selection process, and we have an incredible HR department, recruitment department, and talent management department that I'm just really grateful to work with, and they run a lot of these processes. And so what we do is we sort of look at this piece of it and we say, okay, you know, knowledge and skills tend to be a little bit more trainable. These are things that once people come here, we can teach them skills, we can give them some knowledge. But we really, when we're selecting our employees, focus on this talent piece. These are things like drives and values, work style, people acumen, influence, thought processes that are unique to individual people that we're considering hiring, and that's what we select for. So we use a tool to help us figure out, you know, what people's different strengths are, and the talent management office that I will talk a little bit more about in a little while as well really helps us understand how people's different strengths is potentially going to play into our culture. And one of the relatively recent changes that has happened is that there are certain things within that talent piece that we now require as a baseline before we even consider somebody to work here. So we've been using this sort of selection tool for a long time, but it was a fairly recent change to say, you know, if somebody doesn't pass the baseline minimum for what we're saying that we need as a must-have for our culture, you know, then we don't consider them as an employee. And that was not an easy change to make, but it really, I think, has set us up for a lot of success in terms of making sure that we have the right group of people that then we can disseminate out a lot of the other pieces of what we want our culture to look like. So once we have the employees that we have selected and hired, there's a really important piece of then orienting them to our culture and making sure that we demonstrate what our culture is to them and lay out very clearly the expectations for being part of that culture. So I was absolutely blown away when I first started and came to orientation. On the slide here is our senior leadership team, and our orientation happens every 2 weeks. And so I walked in on my first day, and the entire senior leadership team walked in that morning. They do this every 2 weeks. The whole team comes. During my orientation, not a single one of them was on their phones. They were all engaged. They listened to an individual introduction of every single one of the new employees, and then they each spoke about what brought them to Virginia Hospital Center. They each shared a personal, professional story of some sort about why they got into healthcare, why they care so deeply about our institution, just a really genuine, warm introduction to culture. And I think really sort of setting the expectation that our senior leadership team truly cares and is engaged in that culture. So that to me was a very powerful first statement, and I've heard that from many of our other staff as well as they go through and are oriented. And then the second piece that I have alluded to a little bit is this idea that we make it personal here. So being able to connect back to the purpose of why I got into healthcare, why our leadership got into healthcare, and why every single employee who came decided to get into healthcare. Because we're selecting these, you know, really strong employees, everybody has some reason that they decided they want to be here. They wanted to help people. They wanted to, you know, do the right thing for patients, all of this. And the more that we can connect people back to that purpose in healthcare, remind them of the really important good work that we do, the more we create, I think, employees that are able to remember that throughout the work that they do. I always tell our new employees it can be easy to have this, it's a job. You come and you end up going through the routine of your day. But being able to sort of step back and remember it's a privilege to work in healthcare, and we get the honor of being a part of people's lives at a time that's really quite challenging for them, and we get to be part of that support system. So being able to support each other and remind ourselves of that is really important. We also we're learning how to tell safety stories right now, and we sort of pair that with learning how to share connections to purpose and stories about working with patients, because keeping some of those stories alive, I think, really helps to fuel a lot of that culture. And then the other thing that we speak to very early on at orientation is this idea of empathy. So I've put up this quote by Maya Angelou, and I do it for our new hires as well, and it says, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." And I think this really resonates for our culture in particular, because we're not offering specific scripts or exact wording that people need to use for how to interact with patients and families. What we're doing is we're selecting people that we believe are highly qualified and fit our culture, and then we're empowering them to have genuine interactions with our patients and families. I think it's the genuine nature of that connection that is very, very powerful. And so when we go through orientation, I help to teach a lot of things. So we talk about, communication must-haves, and I'll explain those in a little bit more detail later on. And we talk about, how to have empathy and how to show empathy. And the other thing we spend a lot of time on in orientation is this idea of listening. And listening is something that we all kind of think we do relatively well, but when I talk to our new employees, I tell them that, I personally got into healthcare because I like to fix things, and I like to make things better. And that sometimes makes me not the greatest listener, and there's not always good training on how to listen. So we spend a lot of time thinking about what does it mean to really actively listen, have an open mind, how do we show our patients that we're actively listening to them. It's a really powerful experience to be truly heard and listened to, and we want to make sure that we can facilitate those kinds of conversations taking place. So we spend a lot of time talking about this idea of empathy and this sort of genuine nature that we're hoping that people have. So I'm just going to pause there for a second. We've sort of gone over how it is that we hire our employees and then orienting them to our culture. Are there any questions at this point? Otherwise, I will go on to our education pieces. All right, so I'm not seeing anything, so I'll keep going on. We can always go back to that if anything else comes up. So I want to next talk a little bit about, once we've gotten the right people here and we have them all oriented to our culture, what are the pieces that happen next in terms of the education that we offer, the development, the team building, all of those kinds of things. So I referenced this a little bit earlier, but we have a fantastic talent management office here. And we have two different people. We have a director and a coordinator who help to run it. And they are incredibly skilled at what they do. And they not only help us to make sure that we're hiring the right people and sort of give us a lot of education as to people's strengths before we hire them, but they also offer a number of different things that help to provide ongoing resources to employees who are here. So the first thing I want to talk about are team strength sessions. These are sessions that my department fairly recently did one of, where each of us had completed a strengths assessment of all of the different things that everyone in my department was particularly strong at, and the tool gives the 3 highest strengths for each person. So based on that, we went to this session with the talent management leadership, and they ran an hour-long session to do some team building and help us understand what were the strengths of our team, how they played off of each other, and give us a broader picture of how our team functioned. And then a really nice sort of positive moment at the end is we highlighted everybody's 3 strengths, and everyone had 3 different ones. And we kind of went around and talked for each person as to, what their strength was and how we each as a part of the team really appreciated that particular strength about that person. So people walk out of the session sort of on cloud nine, right? You feel good about yourself, you feel good about your team, we have a better understanding of the team. So really, really nice opportunity to help continue to build that culture and set the expectation of a positive nature across the institution. They also offer leadership coaching, so one-on-one, going to them, trying to get a sense for, any concerns that leaders have. I heard a leader just the other day describe that she had her, monthly session with talent management and just left feeling so much better. And like she had a really good picture of how to kind of approach some of the things happening on her unit that she's hoping to address. They also offer career counseling. So really focused on this idea that we want to encourage growth within our institution. We want people to feel like when they come here, they have opportunities for growth, they have a chance to learn and develop, and so offering that career counseling right within Virginia Hospital Center and being able to offer connections within other departments and things like that really helps to engage our teams. They offer talent tips once a month. So I'm just going to actually skip ahead here and show one of the talent tips. So this was from last month, and again, we're working on a safety strategy, so in an effort to sort of tie everything together, the talent tip for that month focused on a piece of our safety strategy, which is keep a questioning attitude. And so she was sort of highlighting that, to have a questioning attitude using achiever, exactness, and learner talents, which are 3 of the talents that we talk about, these are some of the suggestions that we have for our teams in being able to maintain that safety always strategy within a talent tip format. So these go out by email and are really well received by staff. You'll see they're very easy to read and sort of a really nice overview to jump into. So they also offer a number of different classes. So they have a coaching series, a leadership focus series, and then a number of other things. And so these are 1 to 2 hour-long classes that are typically open to either management or anybody within the institution that really get at typically communication skills. It's a lot of, how to work with your team, how to lead a team, change management type topics, and they've been really, really popular, and they've become sort of a standard part of how we educate our leadership. So all new leaders now are required to go through some of these classes and really making sure that we all have a similar baseline for how we're approaching things. So it's been a really positive section. And if there's any other questions on the talent management office, happy to answer those later on. It's been a really powerful experience to have as part of our hospital. And then in tandem to that, we have created a Patient Experience Academy. So my department is the Patient Experience Department. I have patient relations who does a lot of sort of on-the-ground responding to concerns and complaints, things like that. And we also are really trying to build out much more of this patient experience focus where we're doing a lot of proactive things to try to shape the patient experience. And so part of being able to do that has been thinking about what kind of education can we offer proactively to our employees to help empower them to be able to provide a really strong patient experience. So what we've done is we've created this sort of 101, 201 series, and they happen, I run them usually about quarterly. I run a lot more of the 101s and then some of the higher level courses, since there are prerequisites, happen a little bit less frequently. So Patient Experience 101 is an hour-long class. It's really connecting to purpose in the patient experience. So it's a lot of storytelling, a lot of what I talk about at orientation with, the empathy, active listening, communication skills. We use a couple of must-haves here at Virginia Hospital Center, and so I talk about those very basic must-haves, just making sure that they're really hardwired into our culture. And then Patient Experience 102, when I was asking some of our teams what kinds of classes they would want and what would be most helpful for them and their teams, a lot of people would say back to me, we really want education on dealing with difficult patients. And one of my biggest pet peeves is I absolutely hate the phrase difficult patients because I feel like it really, it sets up an automatic assumption about what it is, and I think it disempowers our staff to really act in a patient-centered way and to have an open mind when dealing with people. So instead of calling it that, I've titled it Meaningful Connection and De-Escalation with Patients and Families Experiencing Stress. So really working hard to create the expectation that it's a stressful experience to come to the hospital. Whether you're here as a patient, a family member, there is something not right happening, and that is really stressful for people. And by virtue of that, we end up with people who are frustrated, upset, scared, vulnerable, and those are some of the behaviors that we sometimes hear labeled as difficult. And so being able to sort of, through the title, think about, these are people experiencing stress. How do we meaningfully connect and then de-escalate? So we talk a lot about service recovery. We have a little acronym called HEAL, which is hear, empathize, apologize, and leave them satisfied, which is what we use to kind of teach the process for that. So that's been a very well-attended class. And then we have Patient Experience 103, which is interpreting and discussing patient satisfaction scores. I'm going to talk a little bit more at the end of this presentation about how we distribute and hold people accountable for patient satisfaction scores throughout our institution. But one of the major pieces is that it can be really confusing, as I'm sure all of you know. You have your percentile rankings, you have mean scores. Depending on how often you share the data, things can go up and down. So I've found it to be really beneficial to offer this class where people can come, sort of get a really basic overview for some of the data definitions, and also then be able to dive into their own scores. We make sure people have access to our vendor's website and are sort of empowered to dive in and gain that information for themselves as they're leading their departments. Patient Experience 201 is actually taught by our patient care directors, who are the nurse leaders on the floor. I think there's a real value in this being sort of nurse-to-nurse education. And so they talk about hourly rounding, why it's so important. We do a lot of discussing the why, and then sort of really getting into how to do it. And paired with this is a series of competency checkoffs, because we really want to make sure that we're not only highlighting and giving the resources for what these things are, but making sure that we're hardwiring them within our organization, and that people have the tools to be using them constantly as a part of their day-to-day, and not just something that they come to an hour for and then don't hear again for another 6 months. And then we have Patient Experience 202, and this is taught by our Senior Director of Behavioral Health. So she talks a lot about when patients have, patients or family members have comorbidities with mental health diagnoses and they are on our clinical floors, how do we create an integrated supportive plan of care for them? So she offers that perspective. And then Patient Experience 203 is actually a little bit of what we're talking about today, which is this idea of how employee engagement interacts with patient experience. And this is really designed for our leadership to understand that by engaging their employees, that's really a very powerful tool for then setting up, being able to move the marker on patient experience. So I will pause there again just to see if there are any questions, and I think there is one that came through. So the question I'm seeing here is, how long do your sessions last? What is the leader's obligation to get staff to these courses? And are all courses required for certain staff? So I'll take them sort of one at a time. The length question is a really interesting one. Each one is an hour. I would have loved for some of them to be longer, but given that we're trying to get frontline staff, it's just really difficult to find the time to get people off of the floors and things like that. So an hour seemed to be sort of the most respectful amount, and I find that we really are able to get into a fair amount of meat within that period of time. Leaders' obligation to get staff to courses is right now purely optional, but what we're actually working on is trying to get some of these courses, instead of just me having them in a main hospital event, taking some of them actually to the floors, and making sure that we can provide that resource right on the units so that it's not quite as onerous to get staff off the floors, because it's incredibly difficult to do that, and we don't want to impact patient care, obviously, to make that happen. And I'm seeing the rest of that question is, are all courses required for certain staff? And that's definitely something we're moving towards happening. Right now, a lot of the leadership is required. And so we're moving towards, again, once we offer it as more of a unit-based option, that will be something that will be more required for the frontline staff. Fantastic question as well. So the next question is, are you able to get providers into the classes? The answer is absolutely. And as we've started to do more of this, we've had a couple of providers come And as word is starting to share, again, similar to how we're going to take these and take them to the unit level, I've started to get requests from groups of providers to tailor some of these conversations to their groups, take it to their meetings, those kinds of things. So we're taking a lot of this content and being able to share it at the provider level as well. But there's a huge amount of interest in that at the moment. And then the final question, and then we'll move on from here, is do the talent management folks work with providers too? And the answer to that is absolutely. They are a huge part of both selecting providers before they're even hired, sort of doing that exact same process providers go through as well, and then offer all of the same resources to our providers as well. So thank you for the great questions. We can always go back to that section if there end up being any others, but I will close that just by saying that this has been a lot of a work in progress. And especially this academy is relatively new, but we've had a really positive response across the institution, and it's been really nice to see the amount of engagement that people have. I find that in general, people feel that they want to improve the patient experience, and in a lot of ways, they're usually held accountable for doing that. But I have a lot of leaders tell me they don't know exactly how to do that. It's the tools that they need to use to do that are often a little bit more difficult when they are focused on, sort of the day-to-day. So what we're trying to get at with this academy and a lot of the other resources that our department is offering is being able to make sure that we can offer those tools to really empower them, not to go in and be doing the things for them, but to really empower them and make sure that they have the tools and the learnings to then be able to do it themselves and sort of share that within their departments. So I will move on from that sort of education team building piece to talk about how it is that we connect in with our employees. We do this on an annual basis. We survey every employee here at Virginia Hospital every year. And our survey vendor for patient satisfaction as well as employee engagement is Ganey. So for years now we've been doing this, and I really like to tell staff that I think that's a relatively unique thing, and it's a real reflection of how much the leadership here genuinely cares about the perspective of patients and families and wanting to make sure that we hear their voice. And whenever you're doing something like an employee engagement survey, the most important crucial element is that there's some follow-up from it. So we work really hard every year to make sure that we can get a very high participation rate. And then from that, we really have the responsibility to say, okay, a large percentage of our employees have participated in this. This is what they're telling us. How do we then move from there to make sure that they've been heard and feel supported? So there's a few different things that we do. One thing that has worked really well throughout our institution in a number of venues are what are called stoplight reports. So I'm guessing most of you are relatively familiar with these, but it's the idea that whenever there are suggestions or ideas that come up, you sort of get put onto a list, and each one receives, a green light, yes, we can make that change, a yellow, we're working on it or we're looking into it, or a red, which is, unfortunately, we're not able to do that this time, and this is why. And so one of the things that we do for follow-up from the Ganey surveys is make sure that we're offering a stoplight report such that our teams and our employees know that they've been heard, that there are some things that absolutely great suggestion, we're able to implement that immediately, some things we can look into and work on, and other things we can't, but here's the reason behind it. And then the additional outcome from our employee surveys is this idea of neutral facilitation. So once our results come back in, all of our departments are given a tier score based on their responses. So the tiers are 1, 2, or 3. Tier 1 are the highest performing departments, Tier 2 are in the middle, and Tier 3 are our lowest performing departments. So once we as an institution see how all of our departments fall out, we've been offering a resource that's available for any department, but is required for Tier 3 departments, which is called neutral facilitation. And the idea here is that leaders across the organization are volunteer, really, to be neutral facilitators and are actually trained by our talent management office to do this neutral facilitation. The leadership of the specific area, the department that has a Tier 3 status or has otherwise chosen to participate, talks about the survey results with their team and picks one tangible thing that came up as a low-scoring item for the group to discuss in more detail. Once that has been identified, there's a meeting that is held led by the neutral facilitator where the leader of the department is not present, and all the members of the department spend time with the neutral facilitator really brainstorming ideas and suggestions. So the idea is, this is a low-performing area. Examples are, communication is poor within my department, or I don't feel that my work-life balance is what I want it to be, things like that. So we spend that time with the neutral facilitator brainstorming, what could happen that would make that better? And if that was to improve, what kinds of things would you see? And the neutral facilitator is really there just to essentially record what are the employees' ideas, what are the things that they would like going forward to help them feel more engaged. And then that information gets shared back with the leader, who, again, goes and does a stoplight report and looks at, that's a fantastic idea, I'm going to implement that immediately, or, I know you'd like that, but we can't, and here's why. So really emphasizing making sure that people are heard. I recently was a neutral facilitator for a couple of different departments and found it to be a very positive experience. The staff really appreciated the opportunity to share, and the ones that I was able to do had a really, positive, engaged group of staff that had some great suggestions, and it was a really nice forum for making that happen. And then, sort of the hope, again, is making sure that they feel engaged beyond that, but it was a really nice way to start. Are there any questions on the employee survey or neutral facilitation? Pause for a moment there. All right, doesn't look like it, so I'm going to go on to our next topic, which is sharing of and accountability for patient experience data. So the way that we think about patient experience is that it encompasses pretty much everything that happens when patients and families are here. And there's really no one way that we have to know how we're doing, but we look at information from a variety of different sources. One of the really valuable ways that we have to know how we're doing is our patient surveys that go out. So we work with Ganey as our survey vendor. We obviously do the HCAHPS required on the inpatient side, and we also voluntarily at this point survey all of our outpatient departments as well, really with the focus on, it's a very beneficial way for us to understand what it is that our patients and families are thinking. And the other piece when I talk about this internally is that these are not just questions, especially the HCAHPS questions, that were designed to be sort of a feel-good sense of how people liked their experience. These are measures, the 8 CMS measures, were designed through thorough amount of research to be things that are tied to safe, high-quality care. And so that's why when we're looking at the inpatient scores and we're really striving for always, of course we're striving for always, because we would never want to provide anything less than always with regards to things that are safe and high quality for our patients. So always tying back that message is a really crucial part of what we're doing. And one of the ways in which we share this across the institution is there's a weekly email that goes out. It comes from our Chief Medical Officer's office. It goes out every Monday morning to every single Virginia Hospital Center employee. And this is a little bit of a screenshot of a part of what it looks like. But just to tie back to the safety piece, it actually also includes a safety scorecard. So the email includes patient satisfaction data as well as safety data, continuing to reinforce that message for all of our employees that these are kind of one and the same. And so what we do is we look at, this is an example of the inpatient scorecard. We also have them for the outpatient areas. So you'll see in yellow on the left-hand side are the 8 different domains for the HCAHPS. And then across the top, each column is one of our different units. And then we actually call it the greenie sheet because the idea is we really want as much of it to be green as possible. And our goal is always 90th percentile. So the piece that I want to explain a little bit that I was first a little confused by when I got here, but have really found to be a fantastic way to share our data and sort of set our expectations internally from a cultural perspective, is that what we share every week is a percentile ranking. So when our patients and families score us, if we have 10 patients and 8 of them say that we always kept their room clean and 2 of them say usually, our raw score, our top box score then is 80%. And what happens with that number, that is not the number that gets put on the spreadsheet. What happens is that that number gets compared to all other hospitals within the Ganey database nationally, and we actually choose to compare by like service line. So if we're looking at our women and infant unit, we take that, we compare to other women and infant units across the country. And we get a number, which is the percentile ranking of how we compare to other hospitals across the country. So the way I read this sheet is, for instance, responsive hospital staff, call button as soon as, did you get help as soon as you wanted it when you push the call button? So there's a unit here that has a 50. And the way I read that is we are performing better than 50% of other hospitals on that measure and not as well as 50% of other hospitals on that measure. Now, our raw score, we might have 98% of our patients saying that we do that pretty well and that they get help as soon as they wanted it when they push the call bell, but 50% of other hospitals are doing better than we are. And so that's the information that we share because we really believe in this culture of continuous improvement and wanting to highlight that then we have an opportunity to do better. And what can we learn and how can we continue to do better for our patients and their families while they're here? So I get a lot of questions about the difference between percentile rank and raw score. And one of the things that I think is really very important is the idea that they're both really valuable. And so at a strategic level, weekly, coming from senior leadership, what we're looking at only is percentile rank. But when I meet with leaders who are running departments, I spend a lot of my time teaching them how to track their raw scores, how to know what their raw scores are, and how to look at them in conjunction with their percentile ranking to get a more complete picture of the patient experience that they're offering. Because one without the other doesn't really give them an operational picture of, did what I do last week make a difference going forward? And we want to make sure that they have those tools to know that what they're implementing is either working or not working. And so being able to see both pieces of that data is a really important component there. I will pause for a second and see if there are any questions on the patient satisfaction piece. I know this is something that a lot of hospitals work very hard at, and we have our leaders, accountable for it. And it's been a really nice when I sort of walk around and ask staff what they think of it. It is at top of mind for people, and so it fulfills that purpose really nicely of helping to support our whole culture that we really do care about the experience that patients are having. And then the last note I'll make on that is that we talk a lot about how it's not just the numbers. So when something is going out every week that has numbers on it, it can be really easy for staff to get tied into the numbers, or, oh, my leaders are responsible for the number being higher, and so we're working on that. And being able to really step back and say, this is not about numbers. These numbers represent real patients, real interactions, real feelings that our patients have had while they're here. And every single interaction that we have with our patients makes a difference. And then this is one of the many ways that we know how we're doing in that regard. So we focus on that message a lot for that very reason, to make sure that while the numbers are important because of what they represent, and that being our mission and why we're all here in healthcare and trying to provide the best care that we can. So I'm going to conclude that piece of it, and I want to just close a little bit by talking about two other topics. One are the must-haves that we have here at Virginia Hospital Center. I just want to talk about some of them that we consider to be absolute requirements, mandatory behaviors within our culture that we teach and empower and hardwire. And then the last topic is really this idea of hardwiring. I think one of the biggest challenges in some of this work is, you start a new initiative, you create some of these materials, you help teach people things, and then you go on to the next thing. And really being able to avoid this flavor of the month idea and making sure that the behaviors that we want to see, that we know are so important for our patients and families and safety, are truly hardwired into the way we do our jobs. That's the hard work of it. So I'll end by talking a little bit more about that. So to start with some of the must-haves, there are just three of them that I want to describe briefly. And the first is communication with patients. So we use an acronym here called NEAR, and it stands for Name, Explain, Ask, and report. We spend a lot of time at orientation talking about this because while it seems like they're very straightforward things, these are really crucial building blocks for communication with patients and families. And we talk about, the main goal of any communication we have with patients and families being to reduce anxiety. When you're in the hospital and you're overwhelmed, really everything we say has an impact on you. And so the way that we introduce ourselves, the way that we explain what's happening, the way that we make ourselves available for questions. It's not sort of a, hey, do you have any questions? And I'm halfway out the door, but really, what questions do you have? I have the time. And then the way that we coordinate their care, given that we are so subspecialized just in healthcare in general, making sure that we really have that reporting function built in. So, our teams aren't always using these all four things exactly in order, but they are using all four of them routinely throughout their day in terms of building connections. And we use the word mandatory a lot. These are mandatory behaviors that we have here that people must do. And then we talk about the why, because we want to reduce the anxiety of our patients and provide safe, high-quality care. So that's the communication piece. And then the next one that we consider to be a must-have is purposeful hourly rounding on patients. This is the idea that I'm sure many of you are familiar with, that every hour, at least, sort of at a minimum, we are checking on our patients. And here we have 5 Ps. I know other places have different things that they check in on during those hourly rounds. But making sure the key here is purposeful hourly rounding. This is not, again, stick your head in. How are you doing? Do you need anything? This is, how is your pain? Do you need to use the bathroom? Are all of your possessions within reach for you? Do you understand your plan of care? All of these different pieces that really are at the heart of patient experience, that when someone is proactively asking about and explaining to our patients, we care deeply about you, we're going to be checking on you at a minimum of every hour, that, again, relieves a lot of anxiety and is found to be tied to a number of things, including better outcomes and also less call bells for staff. So it's sort of a dual purpose where it helps us provide the best care that we can, and it helps our teams do it in a very effective, efficient way for their workflow when they are busy. And so making sure that we're explaining that, and then, again, hardwiring it. And then the third must-have that I just want to highlight quickly is this idea of leadership rounding on staff and patients. So our leaders here are responsible for rounding daily on all of their patients. So those are we call them patient care directors. We have just started actually using a new electronic tool. So they walk around with a tablet that they use to input the information that patients are telling them, so that we have some additional kind of patient experience feedback that we can draw off of. And it also just gives a really powerful sense for how patients are doing, and is a really nice check for how our staff are doing the other must-haves, just to really make sure that we're reinforcing all of those behaviors and checking with the patients to say, are people communicating with you effectively? Kind of a check for, are they using those near techniques? And are you being hourly rounded on? Are you having all of your needs met? It allows us to respond in real time to any concerns and reinforce how seriously we take these things. And then leadership rounding on staff kind of ties back the purpose of this talk, which is the idea that hardwired employee engagement and really strong focus on that is what creates the rest of the patient experience. So making sure that our leadership is rounding on staff, finding out, what are their challenges, what are their barriers, what's important to them, what are their concerns, really being able to empower and engage them in that way, then allows the whole rest of our culture to become patient-focused. And I will just conclude by talking a little bit about hardwiring, which I've mentioned throughout, because it really is, all of the rest of what I've talked about are all things that could be relatively easily set up. You could do a new initiative, you do some education. These things are not particularly difficult, but to me, the hardwiring is the crux of everything. And what we find here on sort of a continuous basis is, we teach it, we set it up, and then we experience this kind of normalization of deviance, right? So, we teach it one way, and then, later on the unit takes it and they tweak it just a little bit, but it's still pretty similar. But then from there it gets tweaked just a little bit more, and you end up with a slightly leaning tower at the end where you say, well, we started over here, now we're tipped a little bit, and so it sometimes just takes some real focus to make sure that we can link back and straighten out a little bit and ensure that things are done consistently, fairly, and cleanly across the board, because we want to have that really consistent experience. And that is what then fuels all three of our legs of this stool being as strong as they are. So I'm going to end there. My hope is to leave about 10 minutes for questions, which is what we have. So I will open it up to the floor for any questions, or turn it back to Mike if there's anything that he wants to finish up with.
Mary, great presentation. I have a quick question for you. If you had to encourage a high leverage strategy as a next step for hospitals, what would you tell them to focus on as a first step?
Yeah, absolutely. That's a great question. I think in general, the messaging of what you're talking about is the crucial first step. I think that it's really easy to jump to specific initiatives and try doing a number of things. You know, you see a number that's red and you kind of want to jump in and fix it. But in my experience, sort of stepping back and being able to look at what is our messaging around patient experience, go out and talk to employees, walk around the floors, find out what people are saying, what their concerns are, what their perceptions are about patient experience, and that gives you a lot of really valuable information for what kinds of initiatives might be successful going forward. And then being able to kind of pick one, maybe two things to dive into and really make sure they're hardwired is a suggestion that I tend to give. It's an exciting process. This field is changing so fast, and there's so many things, but often it's really going back to those basics and being able to hardwire those. That's what makes the biggest difference.
Perfect. Thank you. And I see we have another question here. How much time is spent at orientation? And add on to that, what types of recognition programs do you have?
Perfect. So the orientation question, our orientation in general is 2 days. The piece that the senior leaders do is, it's either half an hour or an hour at the very beginning of the first day. And then I, as the Director of Patient Experience, have an hour and a half on the second day that I cover a lot of the, communication tools, active listening. I give an overview of patient satisfaction data. And I also talk about some of the related things like our interpretive services program and things like that. But for all of that content, it's about an hour and a half. And then the next question was, what types of recognition programs do you have? Fantastic question. We use what's called a STAR program here. And so anyone is able to nominate employees for stars, and it's facilitated through our HR department. And whenever an employee does receive a star, it's documented in their file, and then they receive a little star that goes on their badge. So it's wonderful to walk around and see, employees with badges full of stars who are doing really fantastic work for our patients. And we also try consistently throughout as many different venues as we can throughout the institution to informally be sharing stories of recognition. So whenever in my department I get feedback from a patient that they've had a really good experience, we're taking it to staff meetings, we're sharing it with leadership, and making sure that people are really called out for the good work that they do. And we also try to really encourage a culture of managing each other up. So part of what we talk about with communication tools is even for patients, when we're doing a handoff from one nurse to another, best practice is having both nurses in there at that handoff, and the one who's going out really saying why the nurse who's coming on is so wonderful and how they're confident that they're going to provide, really high level of care to the patient for that next shift. And so it both helps to recognize the employee who's coming on and makes them feel good, and it helps to reassure the patient that they're in really good hands. So we do that at the unit level as well as in as many leadership and other meetings as possible. It's a great question, really key part of the strategy and culture.
All right. And I see, I'm not sure if you caught this one at the tail end. How's your turnover rate since you have such high expectations and low tolerance?
Really interesting question. In general, I tend to find that I'm not sure that our employees would say we have high expectations and low tolerance. I think the way that I would more accurately describe our culture is that we are a positive culture that does the right thing for patients. And we do expect people to adhere to that. And our high performers that we select for and bring in are looking to work in an environment where that's the case. And negativity doesn't last here very long because it doesn't fit in with our culture. So we do work very hard to make sure that we don't have those negative pieces and that any negativity is addressed. But really, we really believe that then that retains the high performers that we have that want to be part of a culture that is so dedicated to doing the right thing for patients. Great question.
Thank you. Okay, I'm not seeing any more questions. Those are great questions, guys. I love the engagement. I'm going to be sending out both the slides again for those who missed the previous communications, as well as Mary's contact information. If you guys have additional questions or after the webinar ends and you think you wish you had asked something, I'll give you the contact information. I'm sure Mary would be willing to hear out your questions and help you guys as well.
Absolutely. Please feel free to reach out.
Perfect. So this concludes our webinar. Thank you so much, Mary, for providing that great content. Again, I'll be uploading this recording as well as the PowerPoint slides to our website, and I'll send out the slides to who missed the previous communication and ensure that you have Mary's contact information. And just a reminder, I look forward to our next webinar next month on patient family advisory councils and how to engage patient advisors. And please reach out to me if you would like to be featured and recognized in our improvement guide, and so we can share your success and the great strategies you guys are implementing across the state with our other hospitals and members. So thank you very much, everyone. I hope you have a great rest of your day and a beautiful weekend, and I will be talking to you guys soon.